In this video, let us study about dorsal column pathway. As you already know, the dorsal column is that part of the white matter of spinal cord which is located between posterior median and posterolateral sulci. Ascending fibers in this region form the dorsal column pathway, and they form one of the two major pathways that carry information from the spinal cord all the way to the cerebral cortex. Dorsal column contains two large ascending tracts, fasciculus gracilis medially and fasciculus cuneatus laterally. Both these fasciculi are seen only in the upper half of the spinal cord. In the lower half, dorsal column is entirely made up of fasciculus gracilis. Fibers of these fasciculi carry conscious proprioception sensations like sense of position and kinesthesia, or exteroceptive sensations like discriminative touch, pressure and vibration. These fibers are of larger caliber and therefore they provide instant body image to the parietal lobe so that the brain understands the position of various parts of the limbs and joints, and this is important for the motor cortex to program and execute movement. Information about various sensations reach the fibers of the fasciculi through one of these following receptors: Meissner's corpuscles, Pacinian corpuscles, Ruffini endings, and Merkel's complexes carry the exteroceptive sensations, whereas neuromuscular spindles and Golgi tendon organs carry the proprioceptive information. Dorsal column afferents travel with every spinal nerve. They reach the spinal cord through the dorsal root. Because they are made up of larger fibers, they enter through the medial stream of the dorsal root. They have their first order neurons in the dorsal root ganglion. After reaching the spinal cord, they do not relay here. Instead, they ascend all the way up to the medulla oblongata, and that ascending bundle of fibers, which are located within the dorsal column, form the dorsal column pathway. So here we are seeing section of the spinal cord at the lumbar, upper thoracic and cervical levels. We will be using the color code for the fibers from different segments as shown here on the left side. At the lumbar levels, the sacral segment fibers are already present in the dorsal column. As the fibers are added at the lumbar segments, the sacral fibers will be displaced towards the midline. Similarly, the lower thoracic segment fibers, when they add up, they will displace both the lumbar and sacral fibers more medially. Now these three group of fibers, that is sacral, lumbar and lower thoracic segmental fibers, which are located in the dorsal column and carrying the information about lower limbs, lower trunk and genitalia, that will form the fasciculus gracilis. In the upper half of the spinal cord, the upper thoracic and the cervical segment fibers are added to the dorsal column successively on more and more lateral aspects. And these two group of fibers carrying the information from the upper limb and upper trunk will form the fasciculus cuneatus. At each segment, the fibers entering the dorsal column give collateral branches to the gray matter, and at each segment, the neurons in the dorsal horn of the spinal cord will give collaterals which will join with the fibers of dorsal column. At the level of cervical region, we see that the fibers are arranged in a particular fashion such that fibers of sacral segments are located medial most and fibers of the cervical segments are the lateral most. Such arrangement of fibers in which different parts of the body have a designated area of representation in the fiber bundle is called as somatotopy. And fibers are not only arranged with definite somatotopy, but also different modalities are arranged in different areas. That is, the most superficial sensations are arranged in a more superficial plane, and the deeper sensations are arranged in the deeper plane. That is, the sensation from the hair follicles are close to the surface, followed by tactile and vibrations information, and proprioception fibers are the deepest. Once these fibers reach medulla oblongata, they relay in gracile and cuneate nuclei. Neurons located in these nuclei will form the second order neurons. Axons of the second order neurons cross the midline and ascend through the brainstem as medial lemniscus to the thalamus. Here we are seeing the section of the medulla at the level of sensory decussation. This roughly corresponds to the area just below the mid-level of the medulla oblongata. In this section, we can see pyramids anteriorly, one on either side of the midline, central gray matter containing the central canal, and then posteriorly a pair of gracile nuclei on either side of the midline, a pair of cuneate nuclei lateral to them, and a pair of accessory cuneate nuclei lateral to the cuneate nuclei. So fibers reaching the medulla via the fasciculus gracilis and fasciculus cuneatus relay in the gracile and cuneate nuclei respectively. Here they'll be synapsing with the neurons of the nuclei. These neurons will form the second order neurons. Axons of the second order neurons go around the central gray matter, cross the midline to the opposite side. So these axons of the second order neurons traveling around the central gray matter are called as internal arcuate fibers. The fiber bundle formed by these axons after crossing over is called as medial lemniscus. We are also seeing the opposite medial lemniscus here. And crossing of these second order axons in the midline is called as sensory decussation. Also notice how the different segmental fibers are arranged during crossing as well as in the medial lemniscus. So in the medial lemniscus, you will observe that sacral fibers occupy the anterior most part and cervical fibers are the posterior most. So now let us see the arrangement of fibers in medial lemniscus in the upper part of the medulla, which we call as open medulla. Here again, on either side of the midline are the pyramids, and more laterally are the olives containing inferior olivary nuclei. Medial lemnisci are still arranged in a longitudinal anteroposteriorly arranged bundle of fibers, and see the arrangement of different segmental fibers here. You'll see that the sacral fibers are still anterior most and cervical fibers are the posterior most. Coming to the pons, this is the basilar part of the pons and this is the tegmental portion. In the basilar part, we see these darker areas made up of pontine nuclei and descending corticospinal and corticobulbar fibers, and transversely running fibers which are the corticopontocerebellar fibers. So just behind this basilar part, we find a set of lemnisci. From medial to laterally, they are medial lemniscus, trigeminal lemniscus and spinal lemniscus. And at higher levels in the pons, a fourth lemniscus, which is known as lateral lemniscus, will also be added, therefore forming a band of lemnisci just behind the basilar part. See how the orientation of medial lemniscus has changed. The fibers in the medial lemnisci will have undergone rotation by about 90 degrees, such that now the sacral fibers will come to lie laterally and cervical fibers come to lie medially. A similar arrangement is also seen in the midbrain. So this is a section of midbrain showing the periaqueductal gray around the cerebral aqueduct and the colliculi at the back. And you're seeing the band of lemnisci. Only thing is here the lemnisci are arranged ventrodorsally rather than from medial to lateral aspect. However, the fiber arrangement is still the same as that of the pons. That is cervical fibers medially and sacral fibers laterally. It's actually easy to remember the somatotopy at various levels. Just do a small exercise with me. Liken your little fingers to the sacral fibers, ring fingers as lumbar fibers, middle fingers as thoracic fibers, and index fingers as cervical fibers. Now hold both your hands together in front of your face such that the palms are facing your face. It's something like a person of Islamic faith praying. you will see that the sacral fibers represented by your little fingers are medial and cervical fibers represented by your index fingers are laterally placed. This is the arrangement of the fibers in spinal cord. Now next, for the somatotopy in the medulla, hold your hands in the namaste position like a person of Hindu faith praying. Sacral fibers are anterior and cervical fibers are posterior, as indicated by the position of your little finger and index fingers. Now coming to the somatotopy in pons and medulla, hold your hands in such a way that the palms are facing forwards. It's almost as though an atheist is saying no to God. So here the sacral fibers are lateral and cervical fibers are medial. See, it's as simple as that. Now once the fibers reach the thalamus, they relay in the neurons in the thalamus, which are located in the ventral posterolateral nucleus. These neurons form the third order neurons, and the axons of these neurons will pass through the internal capsule and reach the primary somatosensory cortex, or area number 312, which is located in the post-central gyrus in the parietal lobe. The arrangement of the fibers is as per the sensory homunculus. Please remember, the dorsal column fibers are carrying information only from trunk and limbs and not from the head region. Now let us look into what happens if there is disturbance in the function of posterior column. It results into a condition called as sensory ataxia. Here, the person finds it difficult to move when it is dark, because as long as his visual impulses are compensating the posterior column impulses, the person has near normal moving around. But the moment visual impulses are blocked, then the person finds it very difficult to balance himself or move without difficulty. Usually, patient balances by standing with his feet apart, and his gait will be broad-based and stamping gait. The stamping nature is not only to feel the ground under his feet, but also to reinforce whatever little conscious proprioceptive fibers which are available. And gaze is constantly towards their feet, just to check where they are putting their feet, so that again vision is trying to compensate absence of information coming from the posterior column. How do we test it? We do two tests. Romberg's test is when you ask the patient to stand with his feet together, and the minute you ask him to close his eyes, the person has severe swaying. Tandem Romberg's sign is you ask the patient to walk in a straight line so that he puts one foot in front of the other. Each time the heel of the foot forward will touch the toes of the foot behind. Now, during this gait, again ask the patient to close his eyes and he will sway severely. Both Romberg's and tandem Romberg sign will be positive even in cerebellar lesions. But the difference is, in case of cerebellar lesion, the patient sways whether his eyes are closed or open. But in case of dorsal column pathway disturbance, patient sways only when the eyes are closed. When his eyes are open, his visual impulses will compensate, at least partially, for the lack of function in the posterior column. When you map for the touch, pain and temperature, these sensations are intact because spinothalamic tract is normal. However, 2-point discrimination test is negative. Patient is also unable to identify a number traced on his skin by the examiner, or he is unable to identify different textures, especially when the objects are of similar shape and size, like a tennis ball with a fruit. He won't be able to make out the difference in the texture. Thank you very much. Hope you enjoyed this video.